The next presentation is done by Jill Hanley. Jill Hanley is a professor at the McGill School of Public Work and scientific director of the Sherpa University Institute on Migration, Health and Social Services. Dr. Hanley's work focuses on closing the gaps between policies and practice concerning the social rights of migrant populations. And this is reflected across the various realms of her work, including at Sherpa, where she leads a team of researchers in studies to enhance frontline interventions with migrants and propose policy changes to improve access to social rights by this group. So,
good morning, everybody. I'm happy to be here and to be on this panel with other similar presentations. I think you're going to hear a bit of echoes. This presentation is about occupational health and safety with a focus on return to work, but for temp agency workers who are immigrant, and we have that little slash there because it includes people all along the spectrum from people who immigrated and became citizens to people who are undocumented at the moment. And I'm sharing a little picture with you here. This is the Temp Agency Workers Council, members of their council from the Immigrant Workers Center, who is was our principal partner for this project. And you see in there a giant paper mache boot because they had a campaign talking about how temp agency workers weren't getting their personal protection equipment provided by the employer. So the boot was a symbol. I'm talking today about a longitudinal project. It was a very fun project to work on. We were able to follow 40 immigrant temp agency workers, and we met them every 4 months for 3 years for qualitative interviews. And this is a really unusual bunch of data we have right now, where we're able to follow people over time, how their experiences with temp agencies changed over time, how it affected their immigration status and vice versa, how it affected their families, how did their employment situation improve over those 3 years. And in addition to that, we were able to do case file analyses. At the Immigrant Workers Center, we analyzed 62 case files about temp agency workers' rights. And with PNAI 44, PNAI is a Filipino women's organization, we were able to analyze 44 case files where with them it was more working through recruitment agencies. So it really gave some interesting information. First of all, the sample we did in those 40 people, it was pretty much half women and men. We had a good representation across many different immigration statuses, but we were also recruiting from 5 different sectors. And you can see here the 5 sectors, and these were identified in collaboration with PNAI and the Immigrant Workers Center about sectors that they thought were important to look at. So professionals, so people working as like accountants in the health sector. Oh, no, that was separate in the health one, but different professionals and the health sector, warehouse workers, food transformation, and day laborers who would be sent all over. The other 4 tended to be sent to relatively stable workplaces. And you can see that there's a difference in who gets recruited for what kind of work. And even we had examples over the years where people would try and break into a different type of agency sector. And if they weren't part of the group that was there, even in some cases they would be like national or racial groups in these sectors, they weren't able to come in. So there's a real segmentation, and we saw it was kind of stable over time. It's not going to be a surprise, I think, to this crowd, but it was extremely common for our participants to talk about having occupational health and safety challenges in their temp agency work. When we did the IWC case file, we were able to see that there were almost 1 in 5 of those cases had workplace accident or injury or reported unsafe working conditions. Again, these are the people who come for problems. Some of them were there for other reasons, but just it was extremely common. And in the qualitative work that we did, it was almost 0, the number of workplaces that were providing all of the health and safety equipment that they should have been given that thing. And what I want to emphasize for today's conference is the role of the triangular employment relationship when you're in a temp agency situation. There have been some improvements in the Quebec legislation in terms of labor standards for temp agency workers, but it hasn't been resolved, I think, on the occupational health and safety side of things. So what we see is that all along the process of occupational health and safety, temp agency workers were facing problems. So I already mentioned that almost never were they provided with the personal protection equipment that they should have. And we didn't see any examples where an agency had a system in place, for example, to reimburse workers for having to buy their steel-toed boots. People talked about buying their own gloves, talked about buying their own safety belts and stuff like this. And here we have an example where a worker knew enough to know that he should be provided this type of equipment, but when he asked in his workplace to the sort of client company, who's going to provide me, they would say talk to the agency would refer them back. They ended up with none, until one of his supervisors tried to do his job without a safety belt and got injured himself. Then they started to do something about it. So this was not an unusual situation, and many people reported doing what they could to protect themselves. Sorry, it's going too out of time. There was also a lot of them talking about just like straight up dangerous conditions in the place. Not just that they should have equipment, but that there was, observably dangerous situations. So one place where it was a chicken processing plant, a lot of heavy machinery. It's a dangerous workplace anyway, but there was a machine that was known to be frequently breaking down, and each time it broke down, it was slowing down production until the supervisor asked them to fix it while it was still turned on. And this woman is reporting that she saw, in her space of time working there, three workers injured while trying to repair a machine that was turned on. One of them whose hand was injured, for long-term disability. And this was not an unusual situation. When we talk about return to work, what we see is a lot of workers, when they were confronted with this type of thing, if they had any option, would just try and get out of that workplace. So there's an abandonment of dangerous workplaces because there's a not confidence that they can actually change the conditions in there. So if they did run into an accident or an illness related to work, getting access to workers' compensation was difficult to do. So Mumtaz already spoke about this issue of discouraging claims. This was very common in what we heard as well. So in this workplace, I think I have seen this documented elsewhere, but this was in a temp agency setting where there was kind of a lottery for all the workers if the workplace could hit 100 days without an accident. So if anyone did have an accident and wanted to report it, they were sort of like ruining everyone else's chance to win the lottery for the prize. So there was a pressure from their colleagues. It's like, is it really serious enough that you have to report it? But also the employer would mobilize that to say, like, hey, before you make a claim, go see HR. They'll talk to you about it. And the result was you were sort of really discouraged from making the claim. This was sort of a creative example of claim suppression, but we also saw a lot of more like straight up front threats to people that their job would be at risk if they made a claim, or that the company would lose its profitability and close or something. So feeling that not only are you putting your own job at risk, but everyone else is. So then return to work. So here's a case where this is a person who, first of all, had like multiple accidents in different workplaces. To take the last example, they were working in a hotel and they slipped while they were cleaning the washroom and banged their head really badly to the point that they had to go see a doctor. And the agency told them, the doctor said that they should rest at home for 1 week. That person had no compensation during that time. There was no reporting to CSST that this had happened. And after the person had been at home unpaid for a week, when they wanted to go back to work, they were informed that there's no more work. Sorry, there's no more work. We ran out of contracts for you. But they knew, because they were still in touch with their former colleagues, that there wasn't indeed many people continuing to work. And they realized that they had sort of been labeled a problem maker at that workplace, and they just didn't want them back. So if we stay with this one for a while, this idea of return to work with temp agency workers, like we heard in the earlier presentation, there's a high number of people who feel that there's no way they can be safe to go back to where they were injured, and so they just don't want to go back to where they were injured. So there's abandonment of their jobs, and without knowing that maybe if they tried to pursue it through CSST, that there would be you can leave your job without having exactly abandoned it and get some compensation for doing that. There's also these type of cases where they're essentially fired, but when you work for a temp agency where you're constantly taking new contracts, it can be hard to prove that you were fired. So this is where the triangular relationship comes in. And also there's the issue of who should really be responsible for that. So does the agency have to take them back? Is the client company supposed to show interest in having them back? And even who's responsible for the injury in the first place gets really unclear for these people. On top of it, when you're dealing with precarious status workers, status comes to play into this a lot. So for example, temp agencies, and usually the worst temp agencies, are one of the only ways that undocumented workers can get certain types of jobs. And if they're in this situation, they're very hard-pressed to be able to put pressure on the agency to contest anything with the employer. We have seen some improvements in this in the last years, that with the labor standards and workers' compensation boards in Quebec, is more and more open to receiving claims from undocumented workers, but it's still a risk for them to expose themselves that way. And for those of them that are, in the middle of immigration proceedings, they're trying to sponsor family members. They're waiting for a sponsorship. They're maybe going through a humanitarian and compassionate claim. There's many cases where if you're in that zone of limbo, being able to show that you have ongoing work, employment, makes a big difference. And even losing your job can put an end to like parental sponsorship, for example, or just you may not have enough money to bring your whole family if you're waiting to. We heard a number of cases where people were trying to sponsor their children and really needed the money, so they couldn't take time off. So return to work is really important to people if they want to go back there, and they may put up with a lot of violations in order to get access to go back to work. But we saw more often that it was not possible for them to go back to that work, and the triangular work relationship made that easy for the employer to pull off. So finally, we have this situation where workers are sort of in a situation, are they going to consent to the violation of their rights? And I really put that in quotes, but when people sort of make a decision that according to their analysis of what the likelihood of outcomes are, their best option is to put up with it and just trying to get through. Or do they circumvent? Do they find a way that they can somehow avoid the dangerous work or bring their own protective equipment or that kind of thing? Or do they contest? And understanding how that is, that's one of the things we're spending some time with in this project, is like, what are the factors that make people in a secure enough situation that they can actually contest? So here we see a few examples of people doing all three of those things. So what are these factors? I already talked about immigration status and whether they have big responsibilities for remittances, sending money back to their countries of origin. What kind of work contract is it? Are they getting cash? Can they even prove who they worked for? We had a number where the employer just denied that they worked for them at all. Lack of information about their rights. Do they know what their rights are? Do they know that even if you don't have a written contract, that you can still make claims? Some people just sort of say, look, the stress and the time that's going to take is not worth it for me. I'd rather just go to the next crappy agency and get the same crappy job there rather than put myself through all of this other difficulty. And just wanting to move on from something that's difficult. Sometimes, though, people have tried to deal with things on their own and it doesn't work. And in the end, they feel like, well, I have nothing to lose. I have nothing to lose here. I might as well make a complaint. So in terms of return to work, if you're working in the field, if you're a frontline worker with injured workers, it's important to talk with the worker about what are their stakes in doing this, what are their objectives, and what do they have to gain or lose by going forward with things. Unfortunately, the formal procedures are not always in people's best interests when they look at what's important to them. So if that's not the case, what else can be done to, defend their rights as much as we can? And what we saw in the case file analysis at the Immigrant Workers Center was often the direct intervention by advocate organizations with the employer often got more results more quickly than doing a formal complaint through the Health and Safety Board. The downside of that is that there's no public record then of this having happened. The upside is workers can more quickly get paid what they should have been paid, get reimbursed for medical expenses, all kinds of stuff like that. And I think that a lot of organizations are nervous about doing this. They feel that they're exposing themselves to repercussions from the employer. The Immigrant Workers Center has been doing that for 25 years, and we've had a few threats of being sued, but never been sued. Knock on wood. Finally, I think that the changes to labor standards and temp agency workers in Quebec have been interesting and have made some improvements, but I think there should be more work in Quebec labor standards, I'm not so sure about other provinces, to make clear that the main responsibility for workplace health and safety, I think, should be with the client agency. They're the ones who control the workplace environment when they're there. They're usually supervising. They control the physical space. And it seems to, this has been documented in other work, including Catherine's, that often the temp agency hiring is a direct strategy to avoid responsibility for that. So I'll end on that. Thank you.